some health-related issues, as Ghana has so far confirmed 43 cholera cases with 2 deaths recorded. 12 persons are currently on admission with close to 200 suspected cases, including some imported cases from neighboring countries. Director of Public Health at the Ghana Health Service, Dr. Franklin Esedu-Bekwin, assures measures have been instituted to curtail the spread, while meetings are ongoing with ECOWAS to ascertain the disease burden within the sub-region. Sarah Penkro reports.
Following the announcement of the cholera outbreak by Ghana Health Service on October 11 in the Adan West and East districts of the Greater Accra region, several key interventions are being rolled out by the various stakeholders to ensure the spread is contained. Insanitary conditions within the coastal communities have been identified as a major contributor to the spread of the disease. Key interventions have been targeted at providing clean water and improving sanitation for residents, especially at the epicenters of the disease. The Director of Public Health at the Ghana Health Service, Dr. Franklin Esedu-Bekwin, says the country's response to the outbreak is in 3 folds, with more focus placed on identifying cases early and tracing their contacts.
We have oral rehabilitation joints that have been set up in the epicenters. The idea is that those who are not vomiting, we are able to give them ORS as early as possible so that we manage the cases. And thankfully, over the past few days, we've gotten quite a number of cases, but they are all mild, so they are not very severe cases. So if you look at the cases on admission, I think there's just about 12 cases on admission. So which is good for us, because in that case, the risk of dying is low. But then the risk of spread is on the high side. We are providing water to these communities, particularly the epicenters in these communities. And then we have worked with the assembly to make sure that they enforce the bylaws. Originally it was like banning funerals, but we have to alter it a bit. So what they are doing is that if you want to have a funeral, you need to have hand washing facilities there, and then they make sure that they don't do parties after the funeral.
According to him, some of the cases were reported from neighboring countries like Togo, Ivory Coast, Benin and Nigeria, all of which are reporting cholera cases.
Just last week, we had this meeting of the West Coast, up in the ECOWAS region, and about 8 countries have cholera. And it's becoming a threat to us, whereby most of these cases are coming from the coastal regions. For the whole of this year, Togo, Cote d'Ivoire, Cameroon, they all have cases. So we had a meeting of the ECOWAS public health people to see how best it can be addressed.
The general public is entreated to practice hygiene in the highest form, with special attention on what they eat and drink.